Okay, ma'am.
Okay. So if you've read and understood, considering it critical care scenario, please tell me, how are you going to take care of this patient's pain now?
Okay, ma'am. This patient is first post-operative day following the hemorrhoidectomy operation. I will manage the patient according to the care of critical ill patient management protocol and ABCD approach.
No,
I
not
go.
ABCD. It's post-operative patient.
Okay, ma'am. Here I will check the airway of the patient, ma'am.
And
Then breathing, respiratory rate, rhythm, chest wall movement. And due to the pain, chest respiratory function may be the impaired due to the inadequate analgesia. And as I also check the circulation and the respiratory, here the heart rate and the blood pressure may be high due to the pain. Then I will check the level of consciousness. If the overdose of the painkiller, there may be the level of consciousness may be the decrease. Then I will go through review the pain chart, the drug chart. Review the drug chart. Is it effective for the patient? Is the drug given to the patient? And is the dose is adequate or not for the patient? Then I'll take the history of the patient and examination. Here the site of the pain, the character of the pain, severity of the pain, radiation, aggravating and relieving factor. Then I'll do the some investigation here, the ABG and the chest X-ray. Then I will manage the patient, involve the uh, pain team and the pharmacist, nurse, and the surgeon and the anesthetist, and follow the whole step ladder pattern. Here the first step has been given, that is the paracetamol. Then I'll choose the second line drug, that is the intermediate state opioids, that is the codeine or the tramadol. If not a response, then the third steps, that is the morphine or pethidine for the patient.
okay, considering that you said you'll go through and you'll observe patient side effects, what are the side effects of a paracetamol? How would a patient present if you think patient has been given overdose?
Patient may be the paracetamol overdose, ma'am.
Yes, please. This is
Yes,
what patient is getting.
yes, ma'am. A patient may be the unconscious or semi-conscious uh, uh, for the overdose of the paracetamol.
Not quite. Would that be the only symptoms would you consider? Is that how a patient with overdose paracetamol would present? Okay, what is the concept that you have to understand when it comes to WHO's World Health Organization's pain ladder?
The first step, second step, and third step. First step is the uh, mild analgesia, that is the paracetamol, non-steroidal anti-inflammatory drugs, the tricyclic drug, and the anticonvulsant drug. The second line, that is the intermediate strength opioid, that is the codeine and tramadol. The third line, that is the strong opioids, that is the morphine.
Okay, please tell me what you understand by patient-controlled analgesia.
Yes, ma'am. And is a sinus pump that is connected IV to allow the patient self-administer the fixed dose of the drug.
Okay,
And here the
yes,
okay, ma'am.
continue, please.
And here the overdose is avoided by the fixed of the dose and the frequency of the administration and the lockout time, and there will be the 1 hour bulb that's the prevent the backflow of the drugs.
Okay. What are the drawbacks for prescribing patient-controlled analgesia to the patient?
Okay, ma'am. The patient should be alert and oriented, and there will be the broken of the line and the sleep disturbance patient not suitable were the confusion and the less mobility of the patient.
And any other?
I can't mention now, ma'am.
Okay. Please tell me how the pain pathway takes place.
Okay, ma'am. It's a nociceptor is then the dorsal horn of the spinal cord. A delta fiber carry the sharpen and C fiber the dolphin. Then the lateral spinothalamic tract to the thalamus. That is the second order neuron. Then the somatosensory tract. That is the third order neuron. Then the ascending way. That is the pain, and descending. That is analgesia and the hypothalamus.
Which fibers carry the pain fibers?
A delta
Quickly.
fiber and C fiber. A delta fiber sharpened, C fiber is the dolphin.
Okay. Right. How would you, okay, right, what more you can tell me about this?
Sorry, ma'am.
Okay, right, just a second. Right, about the pain fiber and management. Right, you told me this. Right. Yes, tomorrow and right. You most of the questions you couldn't answer today. Okay, just suppose you fail to manage the pain. What are the complications that can result?
Okay, man, and there is some complication. Here is the serious complication is the cardiovascular complication is the increase the heart rate, increase blood pressure, myocardial consumption, that is the myocardial infarction, and for the less mobility, there will be the deep vein thrombosis. And the GIT, the delayed gastric emptying, the reduced bowel motility, paralytic alias. In the respiratory system, there is with the atelectasis and the pneumonia.
Okay, where are you going to take manage this patient?
Yes, ICU, ma'am.
Okay. Can you give some examples of opioids which are commonly used?
Yes, ma'am. That is the opioids, the classify pethidine and the fentanyl.
Yes, but how are you going to classify them? Synthetic
Yes,
and
yes, ma'am. Yes, I know.
semi-synthetic and non-synthetic.
The
Okay, what are the
non-synthetic,
conditions?
non-synthetic morphine, codeine. Semi-synthetic is the diamorphine, and synthetic is the pethidine and fentanyl and pethidine. Synthetic.
Okay, please tell me, when would you not advise patient to take non-steroidal anti-inflammatory medications? In which conditions?
Yes, if patient have the any kidney problem and the
One,
patient having the peptic ulcer disease,
okay,
if the respiratory disease
bronchospasm
and
or
the
patient has
yes
coagulopathy.
bronchospasm and the patient have coagulation will be hampered.
Yes, all right, good, thank you.